Here's a list of just some of the completely moronic, stupid, even maybe close to malpractice, harmful, or just dutsy, spoiled, or crappy, or just evil things that I've heard from nurses or seen from nurses in my lifetime. They're going to go back and forth. I'm not going to give too much detail. I'm just going to go through them. Okay, I had no drugs in my system, no alcohol, and I ended up having a fall. Somebody poured alcohol on my clothing as I was going unconscious. I woke up in the emergency room, something to do with my neurological disorder. And you know what the stupid thing the nurse asked me? Why am I sober? Why is there no drugs in my blood? Why is there no drugs in my urine? Why is there no alcohol anywhere in my body? I'm like, what the hell is wrong with this nurse? Um, Maybe because I'm sober. I'm sober, and that's why I seem sober in my blood and urine and hair and body. I'm trying a new thing. It's called sobriety. But seeing as you're going to ask such a stupid question, why the fuck are you asking me if I'm sober? Well, your clothing smelled like booze. Oh, that's because some asshole poured booze on me. That has nothing to do with my choices. I was going unconscious and some idiot from the bar next door is walking by pouring booze. And why the hell does he even have booze on him? You can't bring booze out of a bar that far. How, what do you do? Pull it out of his pants and start pouring on me, thinking I'm some drunk because I don't know, 10 feet from a bar? I didn't even come out of the bar. You're kidding me? They would have shut that down place. The bar would have hated me. I had nothing to do with the bar. So, luckily, there's no alcohol or anything in my body for weeks and weeks prior. But what did these assholes ask me? Why am I sober? So I explain, and I wait to figure out why the hell I wasn't able to walk and I went unconscious and fell and shook so much. Which I'm trying to tell the nurse as she walks away. Guess what they decide to do shortly after I'm awake? Release me. They don't know what's going on. They can't find any drugs in my system. So they decide to do nothing. Okay. Well, that's a stupid one. Okay, I'm talking to a nurse about how I need a do not lift order because my testicles are filled with blood and I have a dripping, and they're thinking that it's blood being pulled down to my testicles, and lifting definitely makes it worse. And the Coca-Cola company is going to fine my company if the Coca-Cola does not get lifted off the cement. And the problem is, all my Coke workers have do not lift orders that are 6 months to a year old. The newest one was over 4 months old, and one person, my manager, really can't lift. The other two people could lift way better than me. So I asked for a do not lift order so nobody hurts me, because these people are lazy. So they're going to force the injured kid with internal bleeding to lift. Just watch. So I asked my doctor for a very important piece of paper. If you're going to make me work, if you're going to make me get jingled around and rip my injuries back open, the least you can do is make sure I'm not lifting 12 2-liters at once. Oh, sorry, the 2 liters come in six 2 liters at once. The 1 liters come in 12. And then, obviously, you get 48 of the 20 ounces. 48 20 ounces in a case. There's plastic cases. Um, Anyways, so let's not have a guy who has visible blood in his testicles and a dripping feeling in his GI and extreme pain in his GI and he's shaking, falling down, and having seizures. Let's not have that guy lift, right? Explain fully to the nurses, my doctors, everybody. When I get home, what do you think the paperwork says? I'm excused from gym class. What gym class? I didn't even know I was in gym class. Wait, I'm not in gym class, so why the fuck are these doctors writing? Oh, the nurse made a mistake. Okay, another stupid mistake. Okay, so there was a cleaner in my room in Lowell that came in. The room hasn't changed in 3 days. I'm literally unable to move. My back is shooting electricity in me, and I almost froze to death. in a frozen, unheated hallway that connected to outside that wasn't much warmer than outside. And because I was freezing to death and I was going unconscious, in and out of conscious, I took what was left of the clonidine so I could just pass out, hoping that I wouldn't wake up, not thinking that it would be deadly, but kind of hoping that it might be. And it was a stupid thing, but I was already dying. There was actually 0 degrees. I wasn't properly dressed, no blankets, nowhere to go again. I'm literally passing out from the cold. I got frostbite on my feet. Things are not going well for me. I have no sleeping meds. I have Seroquel and Clonidine, which I don't want either. I'm just asking for something to help me sleep, and they're giving me those two and some trazodone. Things I told them very well are giving me severe side effects like heart palpitations. So I take some Clonidine, but of course it doesn't kill me. The next day I'm just dizzy. My blood pressure drops. I have no clue how much the bottle is, how much is in there. It's not 120, but that's what the bottle says. So I just tell them that's what the bottle says is 120. Oh, then you must have took 120. No, I took whatever was left in the bottle. And people have been snatching and stealing from my bottle. And you guys don't give a fuck who steals from me, who hits me with a brick, or if I freeze to death every night this week. The shelter doesn't care to let me in because of my disabilities. You guys want me to freeze to death and won't keep me overnight no matter how bad my injuries are. And on top of this, every single police officer wants to arrest me just for being in public. And if I go to any ATM for 30 seconds, they arrest me for trespassing, even though I'm trying to use an ATM to check a balance. Doesn't matter. The morning thing, we used to try to sleep in them, but you can't. There's only a certain time where you can get away with that, and that's when cops aren't around. And that's when they're on their DUI runs. That would be around when the bars close. So from about 1 in the morning to 5 in the morning, there are no police officers doing their rounds downtown, and it's pretty dead. Oh, by the way, I had to keep walking every single night of my life while I was living outside. Oh, I forgot to mention that. Yeah, you're not allowed to stop walking or you're arrested or you freeze to death or you die or somebody robs you or they take your medication or so you're not allowed to stop. If you want to stop, you got to curl up in the woods, hide someplace and then pass the hell out, and then you got to walk for another 3 to 5 days in circles. Not really fun. No one, and once when you've been up that long, you can't sleep anyways because you have so much adrenaline in your body. Plus, if it's 0 degrees, you're freezing to death, so you just knock out from that. Alcohol prevents me from having to wake up and have seizures because I can't move when I wake up. So if I use Ativan alcohol or something like epileptic medication, then I can move in the morning. But they won't give me any epileptic medication because my father and mother want to lie so much. Anyways. So we have that going on. The place is clean. I tell the house cleaner, the place is clean. Leave my room. I don't feel so good. I don't want any company right now. She goes, I need a clean. I need a clean. You have already cleaned everything. This room has not had any changes. I haven't been able to use the bathroom. Nobody's been in here. The doctor hasn't talked to me in 3 days. Nobody gives a shit about checking in on me in this room. There's just the TV on, me in this bed, and I wipe up after myself in the bathroom. Even if you want to clean the bathroom, that's fine, but you don't need to be coming over next to me, moving things around, and then putting them in the same spot. So I tell her, once again, get out of my room. This room is paid for by my insurance. I wish you out of my room now. I would like you out of my room. I do not feel comfortable with you in my room. I'm asking you to leave. No, 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 I need to clean that. Please, Spanish lady who doesn't speak English, leave. Eventually she leaves after I say, get the fuck out. What is wrong with you? Because she's just cleaning right next to me like a jerk now. And I'm like, okay, these people are just like trying to cause me stress at this point. But then it gets worse. The nurse comes in and asks me why I'm threatening her staff. I said, I never threatened her. I asked her to leave my room, leave my room. I asked her to leave my room. I told her she's making me feel uncomfortable. And then I told her to get the fuck out of my room because she's making me feel uncomfortable. I never made any threats to her. I told her that she was making me feel uncomfortable, putting her arms right up against my head, trying to fucking go all around my head and body. She doesn't need to clean near me. She can clean the bathroom or anywhere else. Whatever the hell's going on with your cleaning lady that only understands 5 words in English, when I ask her to leave and I feel uncomfortable with her being so close to me, I expect her to leave. What do you think the nurse ever put in my record? I have no idea. I have no idea what's going on in that fucking hallway. All I know is I got a crazy Spanish woman trying to get up in my space. I ask her to leave, tell her to fucking leave. That's the only word. I say, fucking leave already. That's not a threat. Didn't say I'm gonna bash her. I didn't pick up a weapon and chase her out of the room. I'm sitting in a hospital bed with a frickin' what do you call those things? The things your food go on. A tray on my back in the bed. I literally have a tray flattening out my back so I don't have any seizures. I literally got all these IVs and things around me. I got beeping, the TV, I'm having trouble. And after the Spanish lady does this, I don't know what the hell's going on because this nurse comes in asking why I'm making threats. I go, there are no threats here. I asked the lady to leave my room. That's it. There was no ultimatum, leave my room or else. There was none of that shit. There was none of that. All I asked her to do was leave, told her I felt uncomfortable, and then told her to fucking leave my room. That's it. Exactly like that. Fucking leave my room right now, please. Leave my fucking room. I was clear, nicely, nicely. No matter what I said, she kept on getting closer and closer, bumping into me, and I just don't want that. I don't need that from your house cleaner. So, I asked her to leave. Now you're asking me if I threatened her, and I'm telling you, no, there's no threat. Just please don't have her cleaning next to my head and body, okay? Then they send a person to watch me sleep who wants to always have the TV on. Aren't you going to watch TV? Aren't you going to do something other than sit there? No, I'm kind of enjoying not having seizures right now or injuries. The minute you guys release me, I'm going to be in a ditch someplace bleeding. I keep on looking out that window, and there's ice and snow hanging from it. There's snow and ice hanging from every building, and I'm going to be right under that ice and snow for the next 3 weeks without a place to be. Maybe I find one single place in the next 3 weeks. So, no, I'm going to sit here and try to catch as much sleep and try to heal up before my next seizure that you guys don't do fuck about. But anyways, they don't give a fuck, so they just monitor me for suicide or stuff like that because of the clonidine I took. They don't worry about the frostbite, the freezing to death, the seizures, going unconscious, and the fact that they, on many occasions, couldn't find any drugs in my body, but yet I was seriously injured. And even though I'm telling them that something is wrong, nobody gives a fuck. Even when I had a seizure crossing the road, and I had a head injury, a concussion. I couldn't see straight and I was falling into walls, bashing my head again because I couldn't stand up and everything was all dizzy. They're still releasing me to walk, bashing my head into things while I walk. I'm walking, well, not on purpose. I was walking down the road and it got so dizzy I fell to the left and there was a brick wall to my left, so I kind of just like bumped it. It wasn't a fun bump, and then I dropped and then I had to get back up. So I was getting injured. I was in serious emergency condition as they released me, and now I'm in a gurney walking downtown because they've ripped off my clothing and released me literally in a gurney and underwear. So I'm walking through town with like underwear, some tied up gurneys that fall down showing my underwear, and a gurney on the back because they took all my clothing and then literally released me in that condition. Okay, what other stupid stuff have nurses done? Well, my mother was a nurse and she gave me an overdose, a full bottle of Ipecac, lied to doctors, told them that an overdose was an allergy, and came up with more stories than the Bible. My mother had more stories than the Bible, and at least the Bible might be true. The people who were there for my mother's stories, like the swimming medal, know that they're full of shit. My mother just never saw a swimming medal in her life, that one at least. So she decided to come up with a fantasy at the doctors about my accomplishment. Yep, I won a swimming medal for treading water in the shelter. They were trying to boost my confidence. And then my mother wanted to steal it from me and make up fantasies with the doctor to push drugs into my system. Don't forget about the trafficking. So, we won't get into that nurse stuff right there. Let me see. Recently, I had a nurse who knew I had a neurological disorder. I'm having kidney issues, can't sit up for long without pain. I'm having lots of shakes, muscle spasms, and she needs to draw blood. Now, they know if they draw blood, my arm spasms. I got to hold it back so they don't put the needle right through my arm. Now I have numbness on the skin tip, but when they go deep and jab it deep, it causes a like electrical impulse down my spine. My spine, legs, full body just shakes. It's just a little shake. But when a lady is holding a needle in your arm and your arm shakes, they just jab it right in, right through your arm. So it's best to hold the shakes back, which means I got to tighten up the muscles around the spine, and I got to try to redirect after to my legs so I don't shake if it gets too bad, which is almost impossible, and they have seen this before. I tell them there's spots they can use, but don't interfere with it, and it allows them to wiggle it around, stab it real deep. And, a lot of these people are 26 and they just want to fiddle around, play games. They don't want to listen to the patient. They don't care about neurological disorders. They go, we don't have to listen to you. We don't care about a neurological disorder. We'll go wherever we want. We got 5 years of training. We know what we're doing. And then I shake and I'm seizing. What are you going to fake a seizure? No, I am not. I can't even talk to you. This has been going on for 25 years. Every other nurse has no problem but this one fucking nurse because she continues to jab straight into a nerve cluster that causes a goddamn like electrical impulse up my arm into my spine, and then I just shake a little bit. But then she wants to jam around. The more I shake, the more she jams. The more I shake, the more I jam until I'm almost on the floor. And she doesn't want to stop when I say stop. She doesn't want to use the spots where I say, fine. If you're not going to listen to the patient, don't expect when he has a seizure in front of you or he's shaking in front of you. Meanwhile, other nurses exhibit the symptoms less severe because they listen. So I've had hundreds of nurses understand this perfectly. Meanwhile, one nurse that's really young, inexperienced, has never seen a neurological disorder, wants to be a cunt about it. And when I mean a cunt, I mean a real cunt. Oh, he's shaking. He's shaking. Oh my God. Yeah, I'm shaking. I told you that would happen if you didn't listen. But I can't say that at the time. I can't speak like this. Once when they cause that, I can't speak. I just can't speak at all. It really sucks too because I'm at the mercy of everybody at that point. And they like dragging me, throwing me around. They don't respect me at all. They don't respect my body. And because of my mother and father, they're like, "Hey, let's use the scapegoat excuse. Let's use the scapegoat excuse." I mean, it's just pathetic. It's just pathetic. Like, I got another one for you. When I was bleeding internally, I went in to see the doctor. Now, the nurse and everybody knew what was going on. They gave me the worst doctor that knew nothing about bleeding internally, bleeding, testicles, urology, GI, none of it, as a replacement for my regular doctor. And when he came in, he originally treated it like a mental illness. Then when he looked at it, he goes, "Oh, this is real. Yeah, I'm not trained for this. You need a urologist, and you're going to need to be referred by your primary care." I thought this was my primary care. That's what I asked for. I asked for my primary care to look at this and tell me where I need to be referred. What are you doing then? Well, they told me this was something different. Well, what is it now that you see it? Well, it looks like you're bleeding, filling up with blood in your testicles. I can't tell where the blood is coming from, but it certainly doesn't look like it's from the testicles. There's no swelling like they got hit. So, no, I didn't get hit there or sit on them or anything like that. And I said, I do feel a dripping feeling in the GI, and I have a pain in the GI 2 inches to the left of the belly button. They said, well, that would make sense then. That's probably where it's coming from. I go, okay. I took pictures, showed it to them. But do you think the report got properly filed? Probably not. Do you think that the GI or the urology saw it in time to truly look at what was going on? Nope, took them 6 months to look. You think the nurses truly recorded what they were seeing in my testicles and the doctors? Fuck, they didn't even want to look. They wanted to refer me to a psychiatrist. Why would they do such a thing when you can see it with your own two eyes? Because the goddamn doctors and nurses are misinformed. Doctors are only as good as the information they got. They got good information from me. I got lots of records, lots of years of experience. I got lots of pictures. I mean, there's witnesses who see this going on with me. We got lots of people, hundreds of years of experience. We got doctors at age 7 helping with the diagnosis moving along. But you got to remember from the age of about the overdose all the way to age 19, my mother and father wanted to cover up a crime. My father didn't know he was doing so, but if he just woke the hell up and gave a fuck about me, then he would have realized that his wife was lying. It's very clear. I mean, goddamn, how could you think it would be okay to give extra medication to a child? Your wife said that right in front of you. How do you think it's okay to give extra medication as a punishment? How do you think it's okay to take a child's swimming medal away from them when you have no information about it? How do you think it's okay to cut off your son from teachers and doctors that are helping him with a serious movement of body, and they've seen a big change in his body, and they want to know about medications, and they want to know what's going on at home? When I finally got to Texas, I've now redid the same grade twice. I'm now going to a new school. Did they think it was a good idea to cut me off of doctors and literally cut off all schooling again? And how about going to Maine? Did they think that that was going to be beneficial to my education and my health? When I fell down and almost had a seizure from fireworks and noise up in Maine, do you think they brought me to a physical doctor right away? No, they waited 6 months, and then my mother spilled a bunch of bullshit to the psychiatrist. So what do you think they did? Do you think they helped me with my nervous system? No, they listened to my mother's fantasies about every illness she could come up with. So, of course, now when I go to the hospital or doctors and all they have is my mother's and father's bullshit and all they have is me in front of them, they don't want to look. They don't want to test. They don't want to do nothing. It's much easier to write it off as a mental illness. It costs nothing. Just send them out, send them out, send them out. Do nothing, send them out. Do nothing, send them out. Check them for drugs, send them out. Check them for drugs, send them out. Check them for drugs, send them out. Even when I go in there for black urine and my kidneys are like swollen and I can't stand up, and we have it coming out of my penis black, you're not going to do anything about that? Well, we'll have you come back 4 times to get a CT scan, and then we'll finally give you one that will just tell you there's a cyst on there that shouldn't cause any pain. Then that's not it. I never heard of a cyst turning your urine black or causing this severe of kidney pain. So let's do some testing. Well, you're gonna have to wait a year. A year? I could be dead in a fucking year. Why aren't you guys holding me overnight? Why aren't you guys doing further testing? Why are you guys being jokers? Why do I hear so much bullshit coming from my doctors? Why do I got so many fucking nurses making up stories? I mean, goddamn. This is not helpful one bit. You need trained professionals in this profession. I mean, I can do a better job listening to a fucking patient than these nurses. Is it the doctor that's fucking with these nurses? Are the nurses coming back saying, I think this kid needs to be ran through some neurological testing? And then the doctor's going, nah, he's sober, but he's always drinking, so, I guess sober people fall on the ground, go unconscious, and lose the ability to use their legs, right? He has no drugs in his system, he's sober. But let's just keep releasing him to the cold to have more seizures and falls. And then, of course, when I'm with my father and his new wife, and their granddaughter just touches me on the shoulder and I get electrocuted and jump and my head almost hits the ceiling, and I'm about to be like, hey, no, this has nothing to do with sex, you crazy, crazy people. Yeah, get your crazy, crazy thoughts out of your head. If you want to know what this is about, why I almost hit my head on the ceiling, I'm happy to tell you. But you don't like the answers because the person sitting next to you named Henry, he is partly responsible for why I almost jumped and hit my head on the ceiling. Yes, I get shocked when I get touched, certain noises, certain lights, and there are things that help and there are things that make it worse. Stimulants make it worse. Caffeine. I'm not sure about cocaine because I was never big into it, but I'm sure cocaine would do it too. I never really did meth, but I've been on Ritalin and precursors to meth by doctors before, and I know that doesn't help it at all either. So, how about that new stuff, kratom? Now, I've never had enough to feel any opiate effect. I've only had a cup of tea of it before, but it's just equivalent to a cup of coffee and works the same as coffee. Doesn't get you high when you have a cup of that tea. Now, maybe it's because I had loose leaf in my teapot, but either way, it was just like coffee. It made it much worse. I had more seizures. I had more shakes. It worked exactly as regular coffee when I have a full cup of like Starbucks. Not fucking fun. I've had a seizure before from having too much caffeine, but I didn't know they were called seizures. I didn't know these falls or these when my legs stop working or when I get seriously shocked. I didn't know this was called a neurological disorder, and I didn't know pushing a neurological disorder could cause a seizure. I had no idea what these things mean. But now I do. Now I've done research. I've talked to doctors. I've gone online and talked to doctors who are only willing to answer my questions. See, the problem with going to the emergency room is they're typing in my name. I can go online and describe my symptoms, ask questions, and I'll get fucking honest answers. But as long as they're reading my mother's and father's information, all I can do is get hurt and I can get lots of drugs. Yes, thanks to my mother and father, I can get like amphetamine, Xanax, opiates. I can get Thorazine, Seroquel, Haldol, Risperidone, Lamictal, just about any drug on the market I want, except for epilepsy medication that might stop my seizures, except for any medication that actually might improve my condition. The only medications I really needed as a kid was probably some type of benzo for my anxiety, like they did give me Xanax with super strong, but they probably could have just given me a Valium at bedtime and a Ritalin in the morning, and I probably would have had enough luck. Well, and my mother stopped abusing me with pills and rulers and crazy talk and mind twisting and mind fucks. That stuff would have to stop. But as long as I, you know, had a Valium at bedtime for sleep or something, or just to relax me through the night from all the stress of what was going on, and a Ritalin to help me concentrate in school, the Ritalin would have made me worse if I still had this neurological condition. But as long as my mother wasn't drugging the shit out of me and slipping me pills, that wouldn't be a problem. I would probably just have ADHD. And the fact that all this craziness is going on in my life, a Valium at bedtime would probably be a good idea. But instead, I'm on like more medication than a serial killer. I'm not even joking. If you look at a list of medications from the most dangerous serial killer you can find, my list is bigger. And it's for stupid stuff like winning a swimming medal, jumping in a pool, holding a match to slug slime to do the scientific method, trying to figure out how to light a match, sucking on my skin, an overdose that my mother called, talking about the overdose and asking for help. So my mother and father are making up more stories to cover it up. Well, really, my mother's making up the lies. My father's just signing off on them with no clue what the hell's going on. He doesn't care. He doesn't care. He doesn't want to pay attention. My son's health care was run by my mother. It's all up to my. I don't care. She's in charge of all of it. If she wants to tie his nuts in a bow, I don't want to hear about it. If she wants to shove pills up his ass that make him OD, I don't want to hear about it. If she wants to give him a full bottle of Epicat because he said something and he ate a mushroom, I don't want to hear about it. If you're going to give him an overdose because you want to change the TV and the kid's going to pass out at my feet during the overdose and we're going to have him sleep it off, I don't want to hear about it. That's his attitude.